My goal today is to tell 3 stories about why biology and therapy of Merkel cell carcinoma is making exciting and rapid progress and moving towards therapies that are both less toxic and more effective for patients. So the first story that I'll briefly mention is about how initial management of this cancer should be done, and often we are taught that very wide margins should be taken, but that often doesn't do the best service to the patient, and it may be important to combine radiation with surgery. And if you're going to do radiation, you do not need to do big surgeries because local radiation is very effective. That's story number 1. Then story number 2 is how do we better track and identify recurrences in this cancer? At this point, about 40% of all Merkel cell carcinoma patients will experience a recurrence of their cancer somewhere, and we need to find those early because that allows us to treat them more effectively. And there are now recent tools in terms of better data that's available in terms of how likely a patient is to recur as a function of their stage and how long after their original management, original treatment, it has become. That is, if you're 2 or 3 or 4 years out, the risk of having a recurrence in Merkel is much lower than during the first year. So those data are now available, and I'll talk about a blood test that's available in the United States and in Europe that can track whether this cancer is recurring as a very powerful tool for detecting it early, and meaning you don't need to have as many scans. And of course, the third and most exciting story is progress in systemic therapy, moving from cancer chemotherapy to immune therapy, which has increased the chance of a patient having durable control, that is more than a year without their cancer coming back. It's increased that chance by 10-fold. It used to be 5% only with chemotherapy that would have durable control of their cancer, and now it's about 50%. So that's very exciting and big progress. We have a long way to go for the remainder of patients, but I'm excited to share these stories today with you in beautiful Paris. Thank you.